Yate Bene, Vice President Elijah here. Welcome to our January 18th edition of our COVID-19 Town Hall Update, where we give out timely information, new updates, new data, and just encouragement as well from President Jonathan Nez and myself and our esteemed cast of awesome health professionals here, from our epidemiologists to our doctors and our practitioners and our nurses. So we appreciate all of them. And our prayers go out to our frontline people, our first responders, and just anybody who's helping, whether you're taking food to our people, wood, just helping. And many of you, hopefully all of you, are praying. Just a vital time to join together. And we appreciate you. And thank you for joining us again. As we always do, open up in prayer. And then our updates, I'll introduce Jonathan as our president. So yeah, Shajadi and God, we thank you, Lord, that this day was a new day to work for the people, to bring about changes and enhancements, and to protect our nation, Lord, with the data and knowledge that we've attained this far, 21 months into this pandemic. We pray, Father, that you would save the people, protect the people. Lord, we pray protection upon all of our nurses, our doctors, our first responders, our public safety, police officers, all across the land, and our chapter officials. Everybody's working for the benefit of the people. And we pray for the people of Denetra here, our Dene people. Father, may you bless them. May you increase their faith, Lord, to pray and to just seek you while you may be found. So we thank you again. Thank you that we could just become apprised of all the data and information and pass it out, Lord, for the benefit of the people, being transparent, withholding no needed information, Lord, that the people of the land may be blessed. So thank you for this time. We again ask for your wisdom, Lord, which is the principal thing in order to work these changes and enhancements and improve our Navajo nation, improving the quality of life. So you wish that we prosper even as our soul prospers, Lord. We thank you again for your provision and protection. In Jesus' name I pray. God. Amen and amen. Like I said, it is January 18th, and so welcome to our COVID-19 Town Hall Update. And so without further ado, ladies and gentlemen, our president of the Navajo Nation, Jonathan Nez.
Good morning, and thank you, Vice President, for the prayer. And
Yes, sir.
Good morning to everyone all across the Navajo Nation and the country, and all over the world too. I have folks tuning in from Italy, Flora from Texas, Amelia from Albuquerque, Helen from Blanding. Gosh, there's a lot of viewers on today. Colleen, Rosanna, Amelia. Thank you for joining us, everybody, on the updated town hall. As you may know, we've been having 2 town halls a week lately, and it's because of the increase in cases on the Navajo Nation. Cincinnati, Ohio, good morning. OKC, Oklahoma City, Oklahoma. I heard this morning that you all are having a big uptick in cases, so be careful, those of you turning from Oklahoma. Grand Canyon, Round Rock, Standing Rock, White Cone. Thank you for tuning in, everybody, to today's town hall. And I'll make it brief. Just again, want to get you the information. Wow, Florida too. Gallup, our neighbors. Just to give you an update on what's happening here on the Navajo Nation. Of course, you see an uptick. Eli, if you could put the PowerPoint slide up. I only have one slide I'm going to share with you all today. Del Yazzie will be giving us a thorough update. We haven't had the gating measures updated from last week, so it'll probably be similar. But if you look at the last 14 days, that is how we're looking, ladies and gentlemen, the last 14 days. January 4th to January 17th. And you could see the surge, the uptick in cases from 35 on January 4th to the highest point on January 14th at 525 cases in one day. And with the weekend reports, remember the weekend reports sometimes are low because, you know, the reporting on weekends is slow. As you know, as I've been mentioning, you know, our healthcare professionals are getting sick too, and that also contributes to the lag in information returning back to the Navajo Nation in numbers. But if you look at the yellow line, those are the deaths. 8 deaths since January 4th, and our thoughts and prayers go out to those families and all the families who lost loved ones and those that are recovering. This Omicron variant is very contagious, as you see on the chart. That's what is contributing to the surge, not just here on Navajo. Let me just make this point. If you get a chance, look at what's happening all around us, this country. You have, like I was saying earlier, Oklahoma is having a surge, a big surge, and it's happening all around us. Those that are unvaccinated are ending up in the hospital. We know that. We have a high vaccination rate, 72.5%, and our elders, again, 87% fully vaccinated. I mean, when I say fully vaccinated, I mean 2 shots. I'm not counting boosters. Boosters, those numbers are starting to increase a lot. But if you can see the chart, it contributes to, yes, there are breakthroughs, but not many people are ending up in the hospital, guys. That tells you the vaccine works. Look at the deaths. I know one death is one way too many. I know that. But if you compare that to other jurisdictions, they're having a tough time. Let's pray for them too, as well. As the Vice President said, let's also pray for those that are having the surge. Masks are very important. We're encouraging everybody to double mask. Cloth mask and regular mask, 2 cloth masks. You know, just, you know, when you're out there, limit yourself to going out to the store, going out in public as much as you can. This Omicron variant is very, very contagious, everyone. So we just want you all to be careful, okay? And the testing is at an all-time high. So just be patient. This past weekend, we had testing being done in Tuba City. And many people went there, and vaccinations are still happening. Booster shots. Remember, for Pfizer 12 and up, you can get your booster. 12 to 17 have recently got approved for boosters. So you can get your child to get a booster, ladies and gentlemen. We encourage it. Let's bring that number up high. As you know, we did an executive order for Navajo Nation employees. Our definition of fully vaccinated now includes the booster. So to be fully vaccinated as a Navajo Nation employee, you need 3 shots. That is going to be mandated because as I said, at this point in time, the way it's looking, we're not closing down the Navajo Nation. We're not closing down the government. We need to continue to provide services to our people. Last week, we had some offices that had to close down because their staff got COVID. The office of the controller had to close down. So that means checks weren't issued for their elderly, but they are starting again this week. And we had an update from our controller this morning, and she said that they're going to be issuing out those checks. And I asked about the February 1st when the ARPA checks start going out, and she said they're still planning on getting those checks out, the ARPA hardship checks, starting February, the beginning of February, unless this COVID hits that office again. So let's pray for that office, that and including the entire Navajo Nation government, that we don't see a disruption from high COVID positive cases within the workforce. We will be headed out to some of the high case communities to hand out some masks and some hand sanitizers too. So we are putting together that data and that information so we can go out and help. You know, you notice that we've been out there ever since, be it food and supply distribution or vaccination events. We're not giving up here at the Office of the President, Vice President, Executive Branch. We're going to continue to fight against this virus, these variants, and to be out there in the public, because I think it's very important that people, our constituents, our Navajo Nation people see their leaders, right? Rather than shying away and hiding out behind WebEx or Zoom, but to actually be out there, because it brings comfort and hope to our people that we're going to get through this, especially now during a surge. And so we're going to be safe. We're going to be wearing our masks, double masking. We're probably going to have to go back to wearing our PPEs, full body PPEs. And everything that we did last year, 2 years ago, I mean, just to keep everybody safe. And when we visited the entire 110 chapters, not one of our staff got sick because we were very precautious. We had a leader there that always would tell us, to follow the guidelines, follow protocols. And we started every single food and supply distribution with prayer. And God answered our prayers, and we didn't get sick. So we got to continue to get out into the communities and help. I know that we can't get everybody masks because of the low amounts that are available, or hand sanitizers, but we got to hit these hard hit communities here on Navajo Nation. Remember, wear your mask, social distance, wash your hands / use hand sanitizer, stay at home as much as you can, and get vaccinated, everyone. So here, kodo da isuno tsagi do da nikin nasligi. Aye go de des kid nebike bukao. Ditsa dache. De des kid asaje ashla nezti do bala. Koni keni nebda do na asaje. Le dene or blagana bikeya de ashla din how. So the she you see. Ye go de des kid. He ashon da William don here zel in dan deni we can see zigo do da sinil tna e ashon do yego e ya kon nicht kenig nanle zel in da has trana binagin khadas ze bikijna nashigia jo e ben na che e ashon di konig kenig na do Diego in has tika. Ado do elan hitana all that the deski gibin. John the zegi binina. So ebinina kon he came in an hatchin in the kay, you see, Masana chain, nothing koto Hijopa Dani Kedia. Sashi do the Danes and as a Haishin binina. Ndal Zichi. Sasa e shadow tse do tadano. konde sa e nastas ninde andi yi yada no yada stia konde aberzini kon ze na nishot et nebi ke buka zel in the has tnigi do ba da sigi kun in the has that that eshi bat so dil zindole shikeno leni so alt so go shi kodo de nek echo do the gane kitchen hi jana na si do da hasya do da inosne di na tin kne na kinaha di ze di stoitini the question sky na states that yaifni the never cable car a konde ka nature ashon na chekwil zin the question sky even in a kon kada do ka the never cable car da di ne na khabira tlashi tot in da snisho ada hasya an da khayo do di a kon le ai na liaba wande akon da ilmi to des hat nige herno sauyo tian das tin den kade a shon le basha den aje ya da hadyan ge a shon tian kunna sa nana sa kunna bi ndahaz neo kunna chinsla na ha ni herno do des ke no so ishido hilpeda hazin do des ke no thing. And I just wanted to end with one thing. I mentioned this in Navajo that, bashes, there's a supply chain distribution issue all across the country. I know we always tend to look at Navajo. We think that's all that's happening is on Navajo, but it's happening all across the country where supermarkets are less. And we saw that here happen on Navajo, but the Bashes family and the new company has also restocked those shelves, and we appreciate that from the company. I know everybody's going to start saying, "Well, it costs too much." Well, factor in the gas, factor in all the other stuff when you leave the nation, and even COVID-19, right? Factor that, and there's no dollar figure to that. You catch the virus off the nation, you coming back in with it. Is there a dollar value to that? Savings? So it's best to just utilize the shopping centers that are here on the Navajo Nation. Safest place to be is at home, right? That's what we were told when we were young, and we grew up like that. So continue to take care of yourself, everybody. I'm going to turn the time over to our vice president. He's got an update on those new numbers all around us, and it's very, very high. Take care of yourself. God bless you, and God bless our great Navajo Nation. Vice President, over to you.
Yes, sir. Thank you. Thank you, sir. Appreciate your update. Thank you for your leadership as well. This is ongoing, as our president said. So welcome again to our January 18th COVID-19 Town Hall Update. Yate Bene, Vice President Liza here, Comanche Nishle, Tohana Boss's team, Aro Comanche Deshiche, Asha Desinelli. It's good to be here again. I hope you're in health, feeling well, and even if you're experiencing some of the symptoms, please stay home, and hopefully you'll get well quick. That this is the Omicron is shown itself not to be as debilitating or as the symptoms are said to be not as bad as the various other variants that were out there in the previous 20 months or so. So again, hopefully you're well today, and praying for your nation here. All hands on deck mentality in that regard. So appreciate it. I do have some updates. Although the 3-day weekend, yesterday being Martin Luther King Day, Jr. Day, and some of the reporting figures are delayed. Probably just maybe won't even get them until tomorrow. Not sure, but we do have some updates here for you. In the United States, more nationally, the United States is averaging over 790,000 new daily cases, a tally that includes an artificially low count on Monday when many states did not release data because of the MLK Day there. So that was yesterday. The Omicron surge is slamming understaffed hospitals, where many workers are sick with COVID-19 and others who quit under the pressure of the pandemic have not been replaced. So even as you heard President talk about the supply chain constriction, the effects are being felt. Even our frontline people, our health and first responders, health professionals, those that are given care right now, even them being exposed. Again, this Omicron variant is more contagious, so the need for, as we're all talking about, KN95s or the N95s. The N95 masks, normally made by Honeywell, are nationally made in the U.S., the good old U.S. of A, N95. The KN95 is product made elsewhere, normally in China, normally in other areas, Korea as well, that's where the KN comes from. So again, N95 is made in the United States to standards that was set by EPA and our health professionals. The KN95 is a little bit designed to compete, maybe not as stringent, and the ability to filter out contaminants is a little bit lower. I believe it was 93 point some odd percent effective. So, but still high as far as masks go. Better than the dust mask, better than the surgical masks, and now the KN and the N95s are being advocated for. You want to stay free of this virus, then you're probably wearing an N95 or a KN95, which can be found at most hardware stores, big box stores, outlets, everywhere. These masks are everywhere. Dwindling supply as far as the donations, if you're expecting our office to have some, we do have some limited supply. There's great demand. Again, back to the supply chain constriction. So these will be readily found in your local stores here. So as President said, shop by Navajo, by local. So hopefully and if you don't have them, two masks, and they're saying that the cloth masks, those and the neck gaiters are probably not going to provide much protection with this new Omicron variant. And so again, it is more contagious with symptoms that are not as bad. So that's the latest on that. There, the Centers for Disease and Prevention, or CDC, there are no updates from CDC as we come through this 3-day weekend here. Look to have them in our next update, COVID-19 town hall here real soon. If not this week, then next week again. In Arizona, a little bit closer to home, on January 14th, more than 2,900 patients were battling the virus in hospitals across Arizona, and the PCR test shows that there is a 34% positivity rate. Total cases 21 months into this pandemic in Arizona, 1,645,694, with 23,836 new cases to report. So you see that tremendous surge that is happening in Arizona. A little bit closer to home, total positive cases in Apache County, 18,194, with 108 new cases. Navajo County, 31,529, with 431 cases. Coconino County, 35,135, with 166 new cases to report. News from Colorado, total positive cases, 1,133,675, with 6,279 new cases. In New Mexico, Attorney General Hector Balderas is warning citizens of COVID-19 test scams to be cautious, as scammers could be exploiting the increased need for COVID-19 tests in an effort to steal personal, financial, or medical information. So please be aware when you're getting tested, both at home and at a testing site. So scammers, they always figure out a way to get in your business. So please be careful out there. Total positive cases in the state of New Mexico, 193,736. That was as of Friday. Again, there's no new updated numbers this morning per the 3-day weekend here. San Juan County, numbers sitting at 31,062, and McKinley County, 19,496. Again, no new numbers to report here because of the holiday yesterday. Utah's average daily COVID-19 case rate is now fourth highest in the United States. Only Rhode Island, Delaware, and New York top Utah's average daily COVID-19 cases per 100,000 people. The Beehive State's daily average over the last week is 304 cases per 100,000 people. Friday's data displays a 52% increase in the last 7 days. 2.2 million people in Utah have received at least one COVID-19 vaccine dose. So total positive cases 21 months into this pandemic, 750,000. Total positive cases. It looks like these are some of the new numbers, 750,334. Again, this was as of Friday last week. San Juan County, a little bit closer to home, 3,168. That was as of Friday. And our own Utah Navajo Health System, 1,573, again, as of Friday. So in closing, please, and I'll alert Dr. Jill Jim here, or Captain Brian Johnson, I forgot the order here, who's coming up next, but alerting you as I am closing my segment here. So get tested, stay home if you have symptoms. Again, these are all just messaging that we've been saying from the get-go. Also get tested 5 to 7 days after an exposure to someone who is or you think is positive. So again, we hear this, sometimes it's genetic, sometimes it is a confirmed report, maybe contact tracers calling and whatnot. So again, 5 to 7 days after you may have potentially been exposed. So help keep our hospital emergency rooms ready for medical emergencies. Hospitals are reporting that people with no symptoms or mild symptoms are seeking COVID-19 tests at ERs rather than designated testing sites. So you can see there's a confluence of more and more people coming to those sites again, creating more constriction with less and less staff to attend to these. Here, people are being sent home. Some may even be having some increased symptoms, maybe even being sent home with antibiotics and proper medication to combat pneumonia and bronchitis and the like there. So please, again, just keep yourself safe, stay at home, and just be mindful of, how to take care of yourself. Rest, water, fluids, and food. Hopefully you feel like eating. I know it doesn't, it's not very, most people when they're sick aren't wanting to eat. It's just sit there and take care. But again, again, this is one thing that we're praying again, that the Omicron variant is just probably like a bad flu, cold, and not as lethal. So at least the numbers are showing us that. Wearing a mask helps protect you from COVID-19. Please consider wearing the N95. Again, I covered this, the KN95 mask. Upgrading your mask today will help stop the spread of COVID-19. And if you can't afford the N95 or the KN95, then double up surgical masks. I did announce that earlier. Plan to utilize your hardship check that's coming soon and very soon to stock up on high quality N95s and KN95s to prevent the Omicron variant from spreading. One thing I read too, and perhaps our health professionals can substantiate this here, this Omicron variant, though highly contagious, the symptoms are not as extreme and debilitating and or leading to death or hospitalization. So if that's the case, that's kind of what the CDC and some others are purporting, that we may be seeing the end of this pandemic start to wane, where we get to the known herd immunity, where everybody has had COVID or has the vaccines, and this highly contagious variant Omicron will fizzle out, where it'll be harder and harder, and maybe even not being able to find more new hosts. You all, host people. We are Native American. We are the host people of the land. But did you know you're a host for the virus as well? So that's what this has been all about, is staying safe, saving lives. And so we all have our own way of doing that, following the guidelines. But you all know, and some of you are very confident, and some of you are very, very well adept at staying safe, knowing your surroundings. And so we're asking you to continue to be that, continue to show love and respect for all of our people across the land as we are all in this together. And so earlier this week, lastly, I'll close with this. The Biden administration officials, including Dr. Anthony Fauci, said most people will get the virus. Our advice is for people to take actions. That's what we're doing now. So you'll continue to hear from us as leaders, like getting vaccinated and boosted or wearing masks in public places and prevent themselves from getting COVID-19. So again, that's the latest from the Office of the President and Vice President. Now I'd like to turn our attention to Dr. Jill Jim, Director of our Navajo Health Department here on Navajo. Appreciate her leadership, appreciate everything she's done and working hard. And again, we have an all hands on deck mentality. She has people that are just working so hard, her whole department, her whole division, and we appreciate her leadership. So thank you, Dr. Jill Jim, for an impressive list of events and meetings, and your advocacy at the highest levels there. Thank you again. Yeah.
Thank you, Vice President Hietnon, for all your comments and the work that you do out there in the community, and also supporting the ongoing way to eliminate COVID-19. So also to President Nez, thank you for your messaging as well. And we're all consistent at this point in encouraging people to wear better masks and high quality masks, but if it's not accessible, double mask and use a regular mask and with a fabric mask and whatnot, ensure individuals wear a mask around others. And I just want to thank all the listeners on the call. I'm Dr. Jill Jim. I'm the Executive Director for Navajo Department of Health. In regards to our response to Omicron, last week we initiated some public health emergency orders, and just wanted to reiterate that we're still in a safer at home. And so just encouraging individuals to take precaution when they travel, make sure you're vaccinated or make sure you're boosted. So there are several steps into the vaccine efforts across the Navajo Nation. Not everyone is vaccinated, but also age groups that have been eligible, they're starting to get fully vaccinated, like the lower age groups from ages 5 to 11. And then the booster shots are not available for the 12-year-olds to the 18-year-olds, so they can also get their booster shot based on the recommendations. So even though if your vaccine card has fully vaccinated, just make sure that their date, look at the date on your card and ensure that you are now eligible for a booster shot, because you are after 5 months after receiving your full vaccine series. So just make sure that you are getting that extra booster dose in order to continue to protect you as well. And then also looking at our population in general, just reiterating what everyone is saying is that on Navajo, we are seeing that our hospitals are not as impacted, and we don't see a lot of children that are being also admitted, which is different than in some areas of the states where they're getting swamped with testing and also hospitalizations as well. And also, I know there has been an increased concern around schools, and that was one of our public health emergency orders as well, to put the schools in red status. That allows the schools to take stricter measures around physical distancing, as well as the sports event attendance. So I know round and about this weekend, I did hear that some of the games were initiating more safety guidelines in order to get people admitted, or just eliminating attendance at the high school basketball games, which is good. So I encourage schools to take that initiative, as we have some recommendations in place for testing as well, just to ensure that their schools are all have to comply. Doesn't matter if you're a public school, a private school, a charter school, a BIE school, just to make sure that everyone is following the recommendations. We're also aware that the hybrid learning and virtual learning is also encouraged, strongly encouraged, to have schools to take that into effect. They shall provide hybrid and virtual learning. That means in-person and virtual learning. For schools, I know some school districts across the Navajo Nation have taken that and now have in-home or home packets for their students for 2 weeks at least. And we know that we are still in the midst of the Omicron surge. So I would encourage schools to also make sure they take extra measures as well. So those are just the public health emergency orders that were issued out recently. And if you're not familiar with that, go onto the Navajo Department of Health webpage. We also issued out isolation and quarantine guidelines, which are not entirely adopting the CDC's isolation and quarantine guidelines for schools and the general public. So on the Department of Health webpage, you'll see the guidelines that we have, and all healthcare providers that are providing care to the Navajo people on the Navajo Nation should be using those guidelines when they're providing recommendations for isolation and quarantine. And then we don't have isolation hotels that are available for people to either isolate or quarantine. We know that the state of New Mexico has some resources, but also limited. But in general, isolation hotels are not readily available or widely available for everyone. So making sure that when you are isolating and or quarantining at home, making sure that you are ready to do that. We do have some messaging that we've had a while back on how to prepare for that, making sure you have food available, making errands, making sure people help you with errands such as feeding animals, or either if you have individuals that are not sick, to care for them. So have a plan in place right now, because if without a plan in place, you might be in a situation where you don't want to get everyone infected in the household as well. And so that means when you're traveling on and off the reservation, wear your mask and take all the precautions that we have encouraged everyone to do during this pandemic. And those are the tools that we still have. But in the meantime, get tested if you need to get tested and have symptoms, and also if they're readily available, also seek medical care when you need to as well. When you feel like you can't breathe, or you're having issues and chest pain, those are when you need to get care. Making sure that if you are isolating or quarantining and you need food, you can work with your the nurse or the physician at the health facility, or they work with the Health Command Operations Center, and you can call 928-871-7014 to get assistance with food boxes if you or your family has been impacted by COVID. Once again, that number is 928-871-7014. And lastly, I think for tribal employees, I think Dr. Fowler will elaborate on this, is just reporting cases. It doesn't matter if you're a tribal program employee, or you're a school, or you're either a business on the Navajo Nation, you're all required to report to the Health Command Operations Center portal, where we receive exposures and we follow up with them. So we make sure that we are providing recommendations for cleaning and whatnot, and also getting people situated for tribal employees. So that will be my message today. So I'm going to hand it over to Captain Johnson. He's with the Navajo Area Indian Health Service, and also a team member of the Health Command Operations Center, and making sure that we are all responding to the pandemic at the healthcare system level as well. So take it away, Captain Johnson.
All right, thank you, Dr. Jim. I appreciate the introduction, and thank you for the work you continue to do for the Navajo people and for the Navajo area healthcare system, Navajo Nation healthcare system here on the Navajo Nation. I truly believe that we have a great system here on the Navajo Nation that patients and beneficiaries can take advantage of, and certainly seek the care that they're getting during the COVID-19 pandemic. Again, this is Captain Brian Johnson, and I serve as the Acting Deputy Area Director at Navajo Area Indian Health Service in St. Michael's, Arizona, and work, of course, beside Miss Rosalind So as the Area Director. And of course, we've been in this now for 22 months or so, and certainly we've seen a lot of changes over time. But we continue to fight the good fight, as I think was said earlier on this in this town hall session. And I also want to thank President Nez and Vice President Leiser and Dr. Jim and others for the ongoing communications with the general public to make sure that folks are getting the latest information to have an understanding of what's going on and what we see in the healthcare facilities locally. And again, we continue to meet through the Health Command Operations Center with the Navajo Nation. Of course, Dr. Jim overseeing that operation. And the key there is that there is information being shared across the various healthcare facilities with the administrations to make sure that we're all being as consistent as possible in how we approach COVID-19 and the services that we're providing area-wide. So again, thank you for that. And these town halls are just one way to get information out to the public in that fashion. Of course, I've mentioned before that we do know that Native Americans are disproportionately impacted by this pandemic in terms of COVID-19. And we know that there are some infection rates that are over 3.5 times, higher than other races here in the United States. And we also know that Native Americans and Alaska Natives are 4 times or more to be hospitalized as a result of COVID-19. And these are important statistics for individuals, families to understand, knowing that when you're at a higher vulnerability, at higher risk, it's important to really take advantage of the opportunities you have to protect oneself. And of course, with the Indian Health Service, we continue to advocate and encourage certainly to take advantage of the COVID-19, the vaccines that are available. I know that the audience here has heard over time, and maybe that after a while, folks may not listen as much, but we certainly want to continue sending the message that the vaccines do work, they are effective, and cannot stress the importance on that. And I'll mention a little bit more on that again, as I normally do here on the Facebook session. Of course, if you have any questions about vaccinations here on the Navajo Nation, of course, we are aware that throughout the area, whether you're talking about IHS managed facilities, healthcare facilities, or tribally managed, tribal organization managed health facilities, we do know that vaccinations and testing continue. We also know that with the current uptick in cases across the Navajo Nation, that the number of tests that are occurring have increased substantially. And that was something that we expected, particularly with Omicron, because of the way that it transmits a little bit easier and more quickly than what we experienced in the past with Delta and other variants. And so when I talk about a variant, I do still hear individuals who do get a little bit confused on the topic, and some have believed that when we talk about Omicron and it being the newest variant, some folks try to separate that from COVID, and I just want to say it remains that it's a COVID virus. It's just the type of virus within the COVID family. So it's not two separate things. It is a variant, or it's a mutation. It's just basically a virus that's adapting to its environment, and it changes in order to survive. And in this case, again, Omicron, we see that it's picked up, and we can see that throughout the United States. And so we've been monitoring that, and it's something that through epidemiology work that was done here on the Navajo Nation, where sampling is taken and various types of testing is done, we're able to monitor what's present in our environment. And we know with the help of the Navajo Nation epidemiology program and others that we've been able to identify Omicron here on the nation. So, and we pretty much assumed that that was the case when we started seeing a higher rate of cases picking back up and resulting in another surge, and just noticing just how transmissible it was in our environment. So when we talk about vaccinations with COVID-19, you can still reach out. There's still plenty of vaccine. There's still plenty of access and opportunities to the vaccine here on Navajo Nation. And I really do highly recommend, if you have questions on that, to reach out to your local healthcare facility, no matter where you're at, if you're in to the city, or if you're in Crown Point, or if you're in Shiprock or Gallup. All of these facilities have the vaccine throughout, and I didn't list off all the different facilities, but just mentioning some of the local names here. Also, it's important to know, and again, I like to mention that it can get a little confusing to folks who maybe don't listen to the news every day, or maybe folks who are not able to stay on top of the information as related to COVID-19. But, at this point in the pandemic, we first started off with adults being vaccinated, and those were the only ones being vaccinated. And over time, that has changed. And, of course, here in our local region, we are now vaccinating, doing full doses for ages 5 years old and older. So no matter what your age is, if you're 5-year-old and older, then you are eligible certainly for the full dose series of vaccines, and we continue to utilize the Moderna, the Pfizer, and the Johnson & Johnson when appropriate, and so we do have plenty of supplies for that. So it's and just kind of giving a national picture, as someone may ask, within our Native American populations, how many full doses of vaccine have been provided? We're in the neighborhood of 2.1 million that have been provided when we look at the Indian healthcare system, comprised of both federal and tribal health organizations. So I think that speaks to the turnout from Native Americans and Alaskan Natives across the country, and we certainly do appreciate that turnout, because it is protecting families. It's protecting friends and neighbors, so we do appreciate that. In addition to the vaccines and the full dose vaccines, we particularly noticed, and this has been released through the Centers for Disease Control, and in looking at the effectiveness of the full dose series, and we know that booster shots are an important part of protection in order to fight the Omicron variant that we've been talking about. So since Omicron is in our neighborhood, so to speak, or in our environment locally, then that just makes it even more important that those who are eligible for booster shots do receive those booster shots once you've had your full dose series completed. And there are some waiting times between when you get a full dose series and whenever you go to get your booster shot. And so I do recommend certainly reaching out to your local healthcare facility and talking with them about that. It's generally 5 to 6 months in between those shots, generally speaking. But for your specific situation, you would want to reach out to your local health facility and make sure that they understand your particular, the manufacturer of the vaccine that you use, and then also just your particular situation. And they'll be more than happy to help you with the booster shot. So very, very important to get that done. And we will continue to have those booster shots available just like we do the full dose series as long as we can. And I can tell you that we do share all of our information upward, and it goes all the way back to Washington, D.C., to our headquarters area in Rockville, Maryland, where the information is shared and monitored about these types of supplies. So I also just want to mention that, you know, since we've been talking about Omicron and this being the new variant, I just want to make sure that folks understand as well that you know, our scientific community continues to study and really monitor how people are faring in terms of being fully vaccinated, those who are fully vaccinated with booster shots, and continuing to look at the data in terms of infections, hospitalizations, and any deaths associated with Omicron. What was the situation for each individual? And so those statistics are being gathered and maintained, and that will continue to happen likely past the pandemic that we're in presently, but at least it'll continue throughout and then beyond. So that's something that is happening in the background, and that information will be coming out. And some of it is released on a every so often you'll see studies that have been released on some of that information. And that's where we know that that in terms of the Omicron variant, that these vaccines have been effective, and that particularly when one gets the booster shot, it's even more effective. So please certainly take advantage of that and reach out to your local health facility. We're certainly here to support the community and want to help families and our patients as much as possible. Also, I always like to throw in a plug about the flu vaccine. We're still in the flu season of the year, and so those are also available as well, and individuals are able to get their flu vaccine along with COVID-19 vaccines and boosters. So if you have a concern that you would have to make 2 different trips, that's not necessarily the case. The flu vaccine remains available, and we'll continue to try to keep those supplies in hand as well. So again, reaching out to your local health facility and getting that information. So to summarize here, we continue to experience a large number of cases in regards to COVID infections, and we believe a majority of these to be of the Omicron variant. And it's important to understand that it is highly transmissible, that it's, in other words, it's easy to spread between individuals, particularly those in the same household or those individuals who work together, individuals who gather together indoors in large gatherings. It makes it very easy for that variant to transmit between individuals. We're also continuing to see at our healthcare facilities, just to give you an idea of the transmissibility, we do see in our healthcare facilities, we've noted an increase in our employee healthcare, staff infections, despite attempts to be as careful as we can when employees see patients on a daily basis for many hours a day. The opportunity for infection is greater, of course, and we do see that. So it's important for you to understand out there that the healthcare staff struggle with the same things that the general population struggle with as well. And that's something that we're monitoring and working with our administrative staff on as well. It is fortunate, and I know President and Vice President and Dr. Jim touched on this a little bit, but we're very fortunate that with Omicron at this juncture, at this point in time, Omicron has not, filled our hospitals completely here in the Navajo area. We've been, hovering around somewhere between the mid-50s to 70% for the inpatient setting, and we've been able to maintain our ICUs where they're not fully occupied, which is great news. But, we do not want to give this virus or this variant a chance or an opportunity to change that. And so we need to be doing everything we can, what we're doing now and more, to prevent infections, because we do see in the larger cities around us, the higher levels of care in hospitals that are around our surrounding states, that many times they are full just because of the number of individuals who are getting seriously ill from Omicron. So we've been fortunate locally, but let's continue the fight. Do not let our guard down and continue to do what we can to prevent infections. I also just wanted to mention that, we do release a Navajo area IHS vaccination clinic schedule. And for the month of January, there is one posted. You can find it on the OPVP website on Facebook. And it's also posted at other locations. And I know many of the tribal organization sites are also posting those as well. So please, if you're needing a vaccination, just look for those scheduled clinics, or you can stop by unscheduled, or you can make a phone call and schedule. It's up to you how you want to approach that. But calling ahead and scheduling is a great idea, but we also do have clinics that take place where calling ahead is not required, such as on Saturdays and Sundays, or other times during the week where we have drive-through vaccination clinics at our facilities. Again, can't emphasize enough how important it is if you're 5 years old or older to get that base series of COVID-19. And then, of course, booster shots, actually, those are for individuals 12 years old and older at this point. So if you're 12 years old and older, you're eligible for a booster shot, assuming you have your the full series, the base doses that are required. And so make sure that you keep that in mind as well. It's been touched on in this particular Facebook session that masks continue to be a critical way of preventing Omicron from transmitting. And it's just as important to mention those of you out there who are using only cloth masks or other forms that are not more substantial. The virus has shown a propensity or ability to spread through cloth, and so moving to situations where you're using either KN95 or N95 masks, or wearing double surgical masks or cloth masks with surgical mask underneath. These are all ways to improve the air, to filtrate the air that you breathe, to make sure that it's safe. So we do not recommend relying solely on cloth masks at this time. Please look for ways to improve or increase the filtration capacity on any mask or respirator that you're using. Again, we've talked about avoiding large gatherings. That still remains in effect. We talk about distancing, especially indoors. Hand washing, we always advocate for hand washing, no matter when or why. As pre-pandemic or post-pandemic, hand washing is incredibly important. And we just continue to, encourage everyone to do these prevention tactics to make sure you're doing your part and I'm doing my part to make sure we keep the number of infections down, so that we keep our hospitals and our health centers, relatively low in terms of patient visits as related to Omicron and COVID-19. But with that said, I'm going to stop there, and I believe I'll be turning the time over to Del Yazzie with the Epicenter, and we'll go ahead and do that now, Del. So if you're ready, you have the floor, sir.
Okay. Thank you, Captain Johnson. Hello, everyone. Yate. My name is Del. I'm at the Navajo Epidemiology Center and also at our Health Command Operations Center COVID Epidemiology team. I don't have the normal updates that I usually provide. We are currently updating the gating measures, the numbers today. Due to the holiday yesterday, we were unable to. So maybe later the next town hall we'll be able to share that. But just some brief updates is, as everyone has mentioned, we are seeing a big surge of cases on Navajo. I think even this time around, the numbers that I'm seeing are high numbers. I think are the report that we're going to probably provide later today is going to continue to see that increase in cases, especially over the last 7 days. Our infection rate might also go up a little bit. We'll continue to remain in the red level as far as our COVID response level on the nation. I think we're going to probably see about 2,000, around 2,000 cases, I believe, this time around. Last week, there was about 800 cases that we reported over a 7-day period. I think this time is going to be around 2,000, so that's a big increase from 800 to 2,000 over a 7-day period. We'll, officially provide that later. Still doing the analyses right now. Our testing percentage, test positivity, I think will go up as well. Last week was 26%. I think it might go up to 30% this week. And that's across Navajo Nation for percent positivity for COVID testing across Navajo. And then, as Captain Johnson mentioned, the good thing is our hospital capacity numbers remain below 80%. So not a lot of people are being hospitalized currently based on the numbers we're seeing. So that is that's actually really a great sign and great news for us. We'll update the vaccine numbers as well. And then just last is like within as President has mentioned, the surge in cases on Navajo is not just on Navajo, it's all across. And based on CDC's numbers as of Saturday, especially within our region, the Southwest region, the Four Corners states, are seeing big surges as well. I looked this morning, and Utah and Colorado are actually the top 10 of the states, U.S. states, with a 7-day case rates. So Utah and Colorado started with big numbers over the past 7 days, and also Arizona and New Mexico as well. So within our surrounding areas, there's high COVID cases with high COVID transmission risk. I think that's the reason why the message, staying home is the primary message currently. And then we're going to update the COVID strain surveillance report probably today or tomorrow morning. I did see some number, more COVID, more cases with Omicron variants were detected. So we'll provide that update hopefully later today. So there's also, the high-risk chapters. Last week there were 61 chapters. I believe this time around it's going to be more than 61 chapters making the high-risk COVID list this time around. So just FYI. So last, even though we don't have the official updated numbers yet, but we anticipate to remain in the red level with our high number of cases, and also our testing being, I would say, about 30% test positivity rate over a 7-day period, which is in the red level. And then our contact tracers continue to be insufficient, so that will remain in the red. And then a hospital capacity being below 80% for regular hospital beds and ICU beds, and that's actually in the orange, which is a good sign, as many people mentioned. So, but overall, we'll remain in the red status. So, but we'll provide updated numbers, the official updated numbers, later today. So I'm going to stop here and hand it over to Shema, Dr. Fowler. Take it away. Thank you.